Every day I receive so many questions about fertility. Today we're going to go through some of those questions that I've received from you through social media. I'm Dr. Sharon, owner and founder of OC Fertility. If you have any questions while I'm going through these, please feel free to leave your own question down below. Question number 1, does having normal periods mean that I'm fertile? Sometimes I'll hear this from my patients and they've been told by their own doctor that having normal periods is a sign of fertility. Certainly having abnormal periods is not a good sign of your fertility. Doesn't always mean you can't get pregnant. Just like having normal periods is not necessarily a sign that you're fertile. So don't delay getting attention if you're having normal periods and still not getting pregnant. Question 2, how long should I wait to see a fertility specialist? The recommendation is if you're younger than 35, you should seek attention after a year of trying. If you're older than 35, then you should wait only 6 months. However, if you're having irregular cycles, depending on how many children you want to have, the bigger family you want to have, the sooner you want to seek attention. The truth is most people get pregnant within the first 3 to 6 months they remove contraception. So part of this decision depends on, again, when you're starting your family, how many children you want to have, and whether or not there's other red flags, such as irregular cycles. Question 3, what's the most common fertility myth that I hear? I'm going to say there's probably 2 common ones that I hear. One is if you relax, you'll get pregnant, and that's actually not necessarily true, and it can be really hard for people to hear that. Stress certainly can contribute to infertility, just like it can contribute to any health outcome. It can be really insensitive to tell patients that when they're struggling with infertility, which is really a medical condition. Another myth that I often hear is that birth control pills causes infertility in the future. The fact is that birth control pills does its job by preventing you from getting pregnant while you're taking the birth control pills. One of the issues with birth control pills is that because you're on hormone replacement, it's going to mask what's happening to your ovaries. And so if you're going to be on prolonged birth control pills in your 20s, for instance, you might want to do some ovarian reserve testing to make sure that things aren't changing in the background that might be missed because of the hormone replacement you're receiving from the birth control pills. So going to question 4, another common question is, can birth control pills affect my future fertility? Back to the common myth, birth control pills themselves aren't going to affect your future fertility, except that if you're going to be delaying getting pregnant and you're using birth control pills as your method of contraception, then of course aging is going to affect your future fertility. So it's not the pill, it's the aging that's going to affect your future fertility. Most people will resume their cycles pretty quickly after coming off the pill, and if you don't within a few months, you might want to seek medical attention. How much does age really affect my fertility? This is actually one of the more important factors of a woman and man's fertility. For women, there's 2 phases that her fertility is actually affected by age. People underestimate that even in your early 30s, you start to see a decline in fertility. That decline happens more rapidly in your late 30s. This 35 is kind of a myth. The 2 time frames really is somewhere around 32 to 33. And then again in 37 to 38, you see a decline, particularly not only in the number of eggs, but in the quality of the eggs. There are 3 factors that account for this. One is the declining number of eggs. We're born with all our eggs as women, and we see a lower number of eggs as we age, especially after 37. The decline happens more rapidly. The other factor is the health of the eggs, what we call mitotic spindles, which is the mechanism of fertilization between the egg and the sperm and combining the DNA. We have more errors, so you have more abnormal embryos. And then the third thing is we have what are called mitochondria in the eggs, and those deplete as we get older, and that is an important energy source for the eggs. And so we have, again, less healthy eggs and resulting embryos as we get older as well. In terms of male aging, we also see what's called increasing DNA fragmentation. And we do know that as men get into their 40s, the children born from those men have increased risk for autism, schizophrenia, and other developmental disorders. About 40 to 50% of the time when we see couples with infertility, there is a male factor as well. To put it in perspective, when we look at a couple who's creating embryos at 30, we might say that about 1/4 of their embryos are abnormal. A couple at 40 might have the reverse, maybe only 1/4 of their embryos are normal. So age really matters when it comes to embryo and in particular egg health. Question number 6 is, when should I get my fertility checked? Part of this depends on when you're planning on having a family. If you're not going to be having children anytime soon, as you're entering into your 30s, it's probably a good idea to have your egg reserve checked. Certainly sooner if you already know ahead of time that you're going to delay having children into your 30s. If you already know you're doing a long, extended education and your plan is to wait until at least 30 or mid-30s, then I think the younger you are, the better. The younger you do treatment, such as egg freezing or embryo banking, the fewer treatments you're going to need and the better outcomes you're going to have. This is also true for men if they're going to be waiting until they're much older to have children, but the decade is different for men than it is for women. Men generally don't see a rapid decline in their fertility until they're in their 40s, but certainly if there's any risk factors for either men or women, exposures, health risks, then certainly you want to be tested sooner. Question number 7 is, what is one thing I wish every woman knew about fertility? The truth is that until a woman tries to conceive, there's no way to test her fertility. 1 in 7 now struggle with infertility, and that's across the board in every population. And so until you try to conceive, we can do tests, we can look at hormone levels, but there's really no way to know without trying to conceive whether you can get pregnant. And AMH can tell us your response to treatment, and it can predict if your egg reserve is where we expect it to be for your age, which is informative if you're trying to plan your future family, but it doesn't necessarily tell us if you can get pregnant or not. So for people who are delaying having children, knowing that 1 in 7 struggle with infertility and not knowing if you're that 1 in 7, if you're gonna wait to have children and recognizing that age might be a superimposed risk factor, it's probably worth getting some testing. The other piece of advice I give patients is don't wait too long to seek attention. Most pregnancies are gonna happen within the first 3 to 6 months a couple removes effective contraception. So waiting more than a year or 2 or 3 years doesn't really benefit patients who are trying to conceive because seeking attention as young as possible gives you your best odds of success. The other thing to think about is that sometimes seeking preconception counseling can help reduce your risks during pregnancy. So seeking attention from a reproductive endocrinologist or fertility specialist or even your general OBGYN before you start a family can be helpful in reducing your risks during pregnancy, not just for the parents, the mother, but also to future children, because if you have an unrecognized genetic condition that the parents are carrying, those things can be identified preconception and you might have some options that you're not aware of. There's probably so many questions that you want to ask, and if you haven't heard what you wanted today, please leave a question below and we'd be happy to answer in the future.